Hi, Courtney DiNardo here from MD Anderson in Houston, Texas. And I think this is a great question. What is the real world experience of treating relapsed AML patients with a HMA Venetoclax regimen? Because certainly this was approved in the frontline setting, but given how effective it is in the frontline, more and more people are using it in relapsed patients. And I would say we certainly don't see quite the level of responses that we do in the frontline setting in the relapse setting, of course. But overall, from the various different institutions that have put their experience together, including our own at the MD Anderson, there's probably about a 40% overall response rate, maybe like a 20-25% true CR/CR rate overall for people in the relapse setting receiving an HMA-Ven regimen. And this is on par, if not a little bit better even than various other salvage regimens that are frequently used. And I would say that there are definitely patients who have a higher chance of responding in the relapse setting, and those, no surprise, tend to be the genomics that are the most sensitive in the frontline setting as well. So patients with diploid cytogenetics, patients with NPM1, IDH1, IDH2 mutations, these patients in the relapse setting tend to have an even higher likelihood of responding to an HMA-Ven regimen on the order of like a 60-65% response rate and more of like a 40-45% CR/CRI rate. At least that was what we saw in one of our studies looking at IDH mutated patients receiving HMA-Ven in the relapse setting. And so I think this is absolutely a effective salvage approach for patients with relapsed disease.